But as was demonstrated by this audience today, by those who pulled their hand down, you found a place for that worry. It's a deep psychological term. What did you do with that worry? What did you do with it? In my country, we would say you stuffed it. You just buried it. But, now listen to how I word this. Every time you look a mother in the eye of a child with special needs, understand she had that worry. It may not have lasted her whole pregnancy. It may have been just for a short period of time. For 90 to 95% of those mothers, 100% had the worry. For 90 to 95%, they stuffed it. They buried it. But for every mother that you interact with, what they feared is now what? Everyday reality. Everyday reality. That's why I'm going to encourage you to ask the parents in your caseload this question. Ask every one of them this question. Okay? Because this gets right at where they're at as caregivers. I don't think I shared this with you before. And I want you to word it, if you would, word it as I'm going to suggest. Word it this way. What's the hardest part about having this child in your family right now? Always ask the right now. What's the hardest part about having this child in your family right now? Now, when you ask that, you will get two different categories of answers. One category of answers will deal with daily, practical living things. I can't find a dentist to take care of his teeth because he won't let anybody go through his mouth. You get very practical things. Other times, you'll get at the heart of what's really hard for them at that moment. I had a mother say this to me one time. I'm only going to share one story. I've got a whole section of my journals where mothers are giving me this answer. Her name was Janet. I said, Janet, what's the hardest part about having Rebecca in your family right now? This was her answer. She said, you know, Dr. Rossetti, it's every single morning. When I walk down the hallway, I open the door to her room, and I see her for the first time. Now think, what is she telling me? This is a good mother, who's done everything well. What is she telling me? What she's telling me is, at least at that point in time, every morning, what dies? Her dream. Yes, her hope, her dream dies every single morning. And you can't say to that mother, I can't, I know how you feel. That's words you should not have in your professional vocabulary. You can say, I know this is difficult for you. I know this is difficult. Try to avoid it. I know how you feel. I want you to take that away from today. When you're going to talk with mothers this week, they had that fear. They buried it. Now they face it every day. Okay, it's a very, very powerful thing. Now I want to take you to one more place. You can see how much we're not able to do. This is a chart I put together a number of years ago. This is one of the most helpful things for me. I share this with medical audiences all around the world. This is a way of comparing the typical response on the left when you've delivered a healthy, the baby you expected. Okay. In contrast to the column on the right, which reflects an emotional response when you deliver that baby that you feared, you stuffed that fear, and now you delivered it. This is huge, and this is where your parents are at. I don't speak your language, but I visited with families this morning. This is right where some of your parents are. Okay. And I want you to see the contrasts here. On the left, we have gain and success, joy and relief, in stark contrast to a sense of loss and failure and grief and concern. And for some, it's paralyzing. For some, it almost Paralyzes them. Now, that loss and grief and failure and concern translates, and I'm not sure what letter it starts with in Turkish, but it translates into what I would call in English the G word. What is that G word? Guilt. Guilt. Translates into the G word, which is guilt. There is not a caregiver of a child with special needs on the planet, at least that I've run into in the past 40 years, who has not at one time or another struggled with guilt. In other words, is this my fault? What could I have done differently? What did I do wrong? Okay, is this my fault? Now, I'm going to speak very directly to you right now. These are things you don't read in a book. I have observed there to be two primary types of guilt. Two. One of them is very frequently occurring. One is less frequently occurring, but you will find it. One type of guilt that caregivers will display is what I refer to as real guilt. In other words, the reason why the child is displaying the pattern of delay that they are is indeed because of some behavior, activity, or choice that the mother made. Okay, I've been at deliveries, I've been at hospital staffs, consulting staffs, where a mother walks in the door barely able to walk because she's so drunk. Delivers the baby, drunk, and wants to leave the hospital within 2 hours so she can go back out on the street and find more drugs or alcohol. Okay? Now, the reason why that baby is displaying that pattern of behavior is because of the choices that she's made. And so that can apply to drugs, can apply to alcohol, can apply to all kinds of environmental or risky behaviors that place that child at great risk. I had a nursing student say to me one time, and I knew her to be a heavy drug user during her pregnancy. She got clean. She started nursing school. Okay, but she had this baby before she started nursing school. A very damaged baby. I don't like that word, but you know what I mean. And she said this to me. She said, Dr. Rossetti, as we were talking in a quiet moment, she said, do you think this is my fault? How do you answer that? How do you answer that? Take a step back. Does she know the answer? Yes. Then why did she ask? If she knows the answer, why did she ask? Well, there are two reasons why she asked. Number one, perhaps she's testing you. Perhaps she wants to see your response. If your response is, oh my goodness, you did what? You lost all trust. There will never be good communication between her. All you've done is to make her feel more guilty. But that's only part of the reason why she asks. The worst part about guilt, the worst part about guilt is when you get stuck in it. The worst part about guilt is when it paralyzes you. And so when she asks me that question, do you think this is my fault? And I know her to have been a heavy drug user, street drugs. I can look her in the eye, because I've seen her child, I know her history. I can look her in the eye and say, yes, the choices that you made while you were pregnant, that is the reason why we have such concern about his development right now. That's an honest answer. And that is what your caregivers want. Your parents want honest answers. But you can't stop there. You can't say, yes, this is your fault, and then turn around and walk away. All that does is make her feel more guilty. You must then say to her, I always follow it up with this. You must then say to her, but let me describe for you what we can do about it. Always say the we. You will have some families in your caseload, in your school over the years, who are struggling with guilt. You must always ask them the question, always, maybe not the first day, must always ask them the question, is there any degree to which you feel this is your fault? They want to talk about it. Frankly, they're desperate to talk about it. No one's ever asked them the question. That's real guilt. By far the most frequently occurring type of guilt is what we would call false guilt, where there's nothing that the mother and or the father did that resulted in whatever the issues are for this particular child. I can share with you a personal story regarding false guilt. 5 daughters, okay. After our firstborn died, my wife called me at the hospital. Her name is Ruth. She called me and she said this. This is about 3 or 4 months after the baby died. And she was soon to get pregnant after that. She said this. She said, Lou, I figured it out. And I didn't understand what she meant. And she said, I figured out what happened to the baby. Oh, I mean, your legs, I mean, you're barely surviving grief. And you get a phone call saying, I know why. Okay, and I said, I don't understand. Tell me what you mean. This is what she said. She said, do you remember at the 4-month mark in the pregnancy, we took a short 3 or 4 day holiday to another part of the state? We did nothing. We just rested during those 4 days. I said, yes, I remember that. But she said, do you remember during those 4 days while we were gone, I had forgotten my prenatal vitamins at home? You catch the power of that? You catch the power? She was searching so hard for what? A reason. That all she could think of for perfectly healthy pregnancy was 4 days of missed prenatal vitamins. That's false guilt. Some of your parents are caught in false guilt. Ask them the question. Now, here's what I've discovered for false guilt. You can't talk them out of it. You can't say, oh, that's silly. You shouldn't think that way. That goes nowhere. Okay? What I found is giving them a chance to talk about it, and time makes a difference. So I call that talking and time. If you have parents who are struggling with false guilt, you want to talk about it, you want to give them time to process, to deal with. Okay? Your expectations here are complete versus incomplete. You wanted a good outcome, you did not get a good outcome. You have your wished for baby versus your feared baby. That's those fears that are stuffed. Your self-esteem is increased versus decreased. Never lose sight. Help me with this, mothers. Mothers of children who are in special needs classes or whatever. A large part of your self-esteem is wrapped up in how your son or daughter has done or is doing now. Yes? A large part of your self-esteem, a large part of how you feel about yourself is linked to how your child is doing. That's a driving force for many parents. Mother and child are together versus separated. That applies particularly if the child has to spend an extended amount of time in a hospital. My secretary, for example, her son spent 11 months in the neonatal intensive care nursery. Okay? And so she had 11 months apart from him. Not completely apart, but where he was in an unusual situation. The saddest case I've ever been involved in was a little boy that was born in my community. His mother lived 45 minutes away, 45-minute drive. He was in our nursery for 10 months. And during the course of those 10 months, his mother visited him twice. Twice. And we had social workers, we had psychology, we had mental health professionals, everybody trying to get her to come, and she visited twice. And then, single mother, then it's time to send him home. And you have to send him home with his mother. You have no legal recourse not to do anything, and the outcome is very, very bad. Okay, so that's that issue of together versus separated. Baby's responses are well developed versus absent. Mother takes her baby home. This is a phrase that mothers use repeatedly. I'm going home with empty arms. Okay, and you have to adjust to a new baby versus grieving for the baby that you'll never have. This sequence of steps is very descriptive of how most of your families have walked through the process of welcoming a child with special needs into their home. And I've learned that different cultures are a little bit more open or less open to talking about it. But I would tell you as well, people are people everywhere. And so I have asked parents that question around the world, any measure to which you feel this is your fault. Same response. Same response. Doesn't matter. Ask dads that question. Watch what happens. Okay? And one of the things that's important to do you remember that question, what's the hardest part? Watch what happens when you ask it with both mother and father there. You'll get vastly different answers about 3/4 of the time. You don't even have the words out of your mouth and mother will have an answer. In many instances, the father doesn't have an answer. What does that mean? What does that mean? Does that mean he doesn't care? No. It's just the way men think. Men think in boxes. Okay, so we box everything up. Women think like spaghetti. Everything is intertwined. Okay, men are much better, it's not a good thing necessarily, much more prone to box up their thoughts. So here's the box for my son, here's the box for work, here's the box for home. Women don't have that box. Everything is intertwined. It's not a good thing or a bad thing, it's the way it is. As it relates to families of children with special needs. I would encourage you to keep this in mind as you interact with your families. You have any comments now? Any questions about some of this family stuff? You see how fast we've gone. We have a few minutes for questions. Usually I would spend about 3 or 4 hours just on family material. Any comments or questions that you have? Please, nice and loud. Yeah. Good. Oops. Yes.
Öncelikle geldiğiniz için çok teşekkür etmek istiyorum. İstanbul'da sizi dinlemek ve sizi izleyen, takip eden ve hemen her gün sizin önderliğinizde, sizin hazırladığınız değerlendirmeleri kullanan birisi için çok heyecanlı. Burada olmanız benim için çok, sizi dinlemek özellikle çok büyük bir keyif.
My pleasure.
Eğer zaman ayırabilirseniz teslim manuelini benim için imzalamanızı isteyeceğim. Ama özellikle size teşekkür etmek istediğim farklı gelişim özellikleri olan çocukların ailelerine iletişim becerilerini sadece sözel dil becerileri olmadığı yönündeki görüşlerinizi paylaşmanızla ilgili. Biz bu alanda çalışan kişiler olarak ailelere eğitim vermenin çok önemli olduğunu ve bu eğitimin de en önemli kısmının çocuğun liderliğini takip etmek ve onunla birlikte bir gelişim yolculuğuna çıkmak olduğunu anlatmak istiyoruz. Bunları sizden duymak çok lezzetli oldu. Onun için size teşekkür etmek istiyorum.
Yes. Yes. I want to amplify something that she said. The younger the child, the less direct child things you do. The bulk of your intervention for a child, particularly under 12 to 15 months of age, is directed toward the families. It's only after they are approximately 12 to 15 months of age that you kind of make a shift where your professional activity is now directed maybe equally toward the child and the caregivers. But there's very little you do with a 4-month-old. Even if he has an established risk condition, what kind of treatment, educational treatment, do you provide for a 4-month-old child with Down syndrome? Or anyone of a number of genetic syndromes? There's virtually nothing. But there's a lot you can do to educate those caregivers. You had a question? Oops.
Until now you have talked about more like classical normal families where the mother is most of the time the caregiver and the father is going to work. In the modern world, sometimes the roles differ. We have stay-at-home fathers and we have working mothers. when the roles change, can the gender difference, the box and the spaghetti you talked about, change also? Is it possible for a child to be more attached to the father than the mother? And is it a normal thing, actually?
I hope so. I hope so. Your babies are wired to attach, period.
So it doesn't matter the mother or the father?
They will attach to a primary caregiver. And if that primary caregiver is the father, they will attach in a very healthy manner. All your children need, all babies need, is exposure to a consistent adult. And we would say, and frankly, the literature shows this, that which facilitates attachment, that which makes attachment happen, is hands-on caregiving.
Can that switch in the future as a child develops?
Yes, but I would tell you that if dad, the father, has been the primary caregiver and a close attachment is formed there, you should not become jealous if at 2 he falls down and skins his knee and he runs to his father and not you. The bottom line is good attachment. We don't care who he attaches to. That's what's healthy, is good attachment. I hope they attach to fathers and granddaughters attach to fathers. I had a routine in our home. Every Thursday morning, I would take one of my daughters out to breakfast from when they were 5 years of age on, every Thursday. And they got so used to it that when they would come down the stairs in the morning, I didn't remember whose turn it was for breakfast. They did. And so now once a month, I take my 4-year-old granddaughters out to breakfast together, and that is a unique experience, trust me. I do have something I'd like to give away, and I thought of a way to do that. One more question, please.
Do you prefer in English or Turkish?
Whatever is best for you.
Turkish is better. Thank you. Birden fazla engeli olan çocuklarda Türkiye'de genelde yapılan önce hayati problemlerine çözümü var, sonra iletişimle ilgili terapilere ya da işte rehabilitasyona başlamak. Özellikle hani yoğun bakımda yatıyorsa ya da işte birden fazla engeli var ve hastane yatışları varsa genelde Türkiye'deki yaklaşım onun iyileşmesini beklemek. Evde de sürebilir bu süreç, hastanede de. Sizin kliniğinizde de bu süreç böyle mi işliyor? Yani sonraki aşamaya mı geçiyorsunuz?
Yes. That's a natural course of events, that you would care for the child's immediate needs. I would tell you that there's something you need to be conscious of when for the first year the primary focus is on the medical side of it. And I learned this from a question that a mother asked me a number of years ago. This is a mother of a 1-year-old. I wrote this down in my journal. She said this. She said, for the first year of her life, all we knew how to do was to keep her alive. Now can you teach us how to love her? That's a very significant question. You see, and for that first year, other people were the primary caregivers. Other people were changing her diaper. Other people were feeding her. Other people were caring for her medical needs, and she didn't have a chance because the child was so fragile. And now she wanted to learn how to love the child. So what do you tell her? Shift your focus. You're the caregiver now. And because you're a good mother, the love part will take place. I have something I'd like to give to someone here in the audience. You're going to have to help me with this. Who, I don't know how best to do this. Who traveled the furthest distance to get here? I don't know my geography. Where did you come from? We have people here from Ankara, yes. From where?
She's from Ankara. She's far.
It's far.
Yeah, far more than Ankara.
Further than that? Anybody further than that? From where? Oh, that doesn't count. You're from Georgia. That doesn't count. That's in the States, Georgia. Did you come here for this conference from Amsterdam?
Otistik torunum var. Sizin bilgilerinizden yararlanmak için geldim.
Otistik bir torunum var. Sizin bilgilerinizden yararlanmak için Amsterdam'da yaşıyor kızım. Uzun yoldan geldi.
I'm very glad you're here. And is that the furthest? Is that the furthest? Yes? Yes, okay. I have something for you as the person who traveled the furthest to get here. My gift to you. I am very appreciative for your patience today. It's not easy to sit for 3 hours. I understand that. And I desperately wanted to avoid trying to cover too much in 3 hours. This is part of 30 plus hours of instruction. If the opportunity would arise for me to come back, I would be happy to do that. I haven't sampled enough Turkish food yet, so I will come back. But thank you very much for your kindness. Thank you.
Ben 3 saatin nasıl geçtiğini anlamadım. Herhalde sizler için de aynı şekilde olduğundan eminim. Hem katkılar hem yorumlarla öğrendiklerimizle unutmayacağımız bir 3 saat oldu. Bu toplantıyı düzenleyenler adına kurum yöneticisi olan arkadaşımız Serhat Bostancı Eren'i ben sahneye davet etmek istiyorum. Belki onda söylemek istediği bir şeyler vardır. Buyurun.
Öncelikle hepinize geldiğiniz için teşekkür ediyorum. Yıllardır beni süpervize eden hocama, Doktor Rossetti'ye. Umarım keyifli vakit geçirmişsinizdir. Hocamızdan yararlanmışsınızdır. Teşekkürler. Herkese iyi akşamlar.
Doktor Rossetti'ye tekrar Türkiye'ye bir daha gelmesini dört gözle bekleyecek birçok kişi var. Çünkü öğrenecek konular hiçbir zaman bitmiyor. Hepimiz için bilginin sonu yok. O işimizin meslek profesyoneller için en önemli yanı o. Aileler açısından da yeni bakış açılarını, belki bazıları daha önce duyduklarına benzeseler bile başka yerlerde, başka insanların da benzer şekilde düşünceleri olduğunu duymaları önemli. Çok teşekkür ediyorum size.